Hi everyone. Thank you so much for joining us for another webinar session at Dr. Curnew's clinic. We did like to do a topic on navigating technology a few times a year just to sort of refresh some of the skills that are really helpful for you in terms of navigating and managing your health in a very technology-driven world these days, especially throughout the global pandemic. And so we wanted to just discuss a few different topics, which Enya will be introducing. So without further ado, I would like to pass it along to Enya, who's going to be going over the table of contents and introducing our first topic of discussion today.
All right, so today what we have in our webinar is going to be, first we're going to be talking about the COVID vaccines. Then we're going to talk about how we can find reliable information. Then we're going to be talking about preparing for your virtual visit. And finally, we're going to be talking about some important apps that you should maybe invest in or try to use during COVID. And so let's start with some of the more recent information on the COVID-19 vaccines. The government of Ontario has begun to encourage people to get their third booster dose, and those that are eligible include individuals aged 18 and over, as long as it's been 3 months since their second dose, individuals aged 50 and over, and those who have already booked their appointment at an interval of 6 months can rebook for an earlier date at the 3-month interval through Ontario's booking portal or by calling the Provincial Vaccine Contact Center. And so Health Canada has authorized mRNA vaccines, which include Pfizer, BioNTech, and Moderna, to be provided for these booster doses. Either can be safely used, regardless of which vaccine was used first for the first 2 doses. And as of now, all Ontarians born 2016 and earlier are eligible for their vaccines, either first or second doses. And so let's talk about how we can book our COVID vaccine appointment. And so there are 2 main ways to do these, either online or over the phone. When booking online, ensure you have a green photo health card, a valid email address, and your web browser is up to date. So Internet Explorer 11 or earlier cannot be used, unfortunately. And by phone, you can contact the Provincial Contact Center at this number posted here. And this is for Ontario, of course. And so to start off, when you're booking your vaccine appointment online, please visit www.covid19.ontariohealth.ca. And once you get to that page, please click on Book Your Vaccine Appointment. And so here's a photo of what your browser should be looking like, what the website should be looking like. And so once you've clicked, there may be a way to access the booking site, and click on Vaccine Support page, which is right under Vaccine Help, if you require any assistance. So once you finish waiting, please enter your health card, birthday, and postal code to proceed. So all the information is right here in the screenshot there posted. The website will prompt you to give any information you may need. And once you have inputted all that information, you'll be coming to this page, and please select the vaccine appointment booking option, which is in the purple there, and press continue. And so the system will go through your records and will determine if you already received your first 2 doses of the COVID vaccine. Then it'll ask you to determine what age group you belong to and determine your eligibility for the booster dose. If you are eligible, then please click the blue book appointment button at the bottom to proceed. And once you click that button, this site will bring you to this page so you can find a vaccination center. And you can enter your postal code to find a vaccination center that's near you. And so under the filter locations option right here in the screenshot, you can actually use the drop-down menu to change how close or far you would like the location to be. And once you've chosen the location, you'll then be asked to select a date and time for your appointment using the calendar, which is on the next slide. And to confirm your appointment, just please select the date with an available time slot you would like, and you're all set. You will also receive an email just confirming your vaccination, your appointment, and the email will go to the one you entered at the beginning. And when you go to appointment, please remember to bring your health card and also have your email handy.
Okay, so now moving on to how you can stay informed during the COVID-19 pandemic. So according to Stats Canada, during the first few months of this health crisis, 96% of Canadians who used the internet to find information saw COVID-19 information that they suspected was misleading, false, and inaccurate. So what are some questions you should consider when looking at a piece of information? So for example, you might ask, who wrote this? When was this released? And can this be verified? So going more in depth into who wrote this, some things you can look into are someone's credentials. So you could look into whether or not they are an expert in this field, look into what particular area of their background is allowing them to speak on this topic. Another thing you might want to consider is why would they choose to write this? Oftentimes there are some biases in pieces of information that you find online. And so you might want to better understand what are the ulterior motives to publishing this piece of article or news. And that's why today we are going to be really highlighting really credible information, and those are usually made available by the government. So you would see them as websites ending with .gov, and also public health organizations like the WHO. They are usually very reliable and they have the most up-to-date information. So when was this information released? So how you could check this is usually on the article or on a piece of information, there would be a published date or last updated date. And that usually tells you when the information was released. However, older doesn't necessarily mean it's not trustworthy. Sometimes government websites don't update very frequently if there is no need for an update. So that would just mean it's the most up-to-date information that is readily available. However, there are certain information that are very time sensitive, such as current restrictions, for example, or current eligibility criteria for booster doses. So they're definitely depending on the type of information you're looking at, the date would matter. And also, you could always use your doctor as a reliable source of information. So for example, Dr. Curnew, and you can always verify with the team of volunteers we have here if you're ever unsure or have any questions about information that you receive. And finally, can this information be verified? So some things you might want to look into is whether or not there are multiple sources citing the same thing that you're reading online. And usually, if there are multiple sources saying similar things, and if they're from reliable sources, they would meet the verifier check or the quality check. And this really just helps you confirm the information that you're seeing online. But definitely still follow all the other criteria just to make sure you're getting the most reliable information, and not just rely on basically seeing if there are multiple sources saying the same things. But this is a great way to tell. Yep. And this is just a very nice summary slide to tell you how to spot fake news. So here we have consider the source. So you may want to click from the story, investigate the site, and just really look into what its missions and motives are. You may want to read beyond just the headlines, for example. Headlines are usually framed to be capturing your attention, but you may want to read the entire story before jumping to conclusions. And oftentimes you want to check on the author. So sometimes some websites don't even have authors. So that might kind of reduce the credibility of that website. So you may want to just look into who the author is, what is their background, and is the information they're saying relevant to what their work is on. Supporting sources, so sometimes websites would have relevant links that they're citing from perhaps journal articles or information from the WHO or CDC. And those are usually reliable sources, and really allows you to also just, if you wanted to read further, they're really useful for you. Checking the date, so yes, looking into recency. Also looking into if it was a joke. sometimes some articles are posted online that were not meant to be used as information, and instead it was more of like a satire. Checking your own biases. Um, as we mentioned, sometimes websites um, may be framed in a way that is not meant to provide information in the most neutral form. So you may want to see whether or not it's biased in one way or another. And finally, ask your experts. So this may be a librarian, it may be Dr. Curnew, and they usually might be able to give you a more professional opinion on the information you are seeing. So now moving on to what are some reliable sources that you could use for COVID-19 vaccines specifically. And there's one really good website provided by the Government of Ontario, and it's linked over here. It's covid-19.ontario.ca. And over here in the image, you can see there's a drop-down menu. And if you wanted to find more information about vaccines in particular, you can click on vaccines, and there are several drop-down options that you can read further if one of them strikes your interest. So moving on to, if we were to click on vaccines for Ontario, this is a good webpage for you to learn about Ontario's vaccination program to help us protect against COVID-19. And there's another menu option called Getting the COVID-19 Vaccine. And essentially, this is, as what Anya talked about, this is where you can learn how and where you can book an appointment for a COVID-19 vaccine. And then on the next slide, we have, yes, how to book an appointment. And essentially, yeah, this is where you can choose to book your first, second, or booster dose. And then on the following slide, what to expect. So this slide really tells you what to expect before and also after your COVID-19 vaccine appointment. So things like what to bring, and also things like what are some side effects that I may expect after getting my vaccine. And then on the next slide, we have pharmacy locations. So this really tells you, I believe you can enter your postal code, and this will tell you a list of locations that are closest to you, and what types of vaccines are available at the pharmacy closest to you, and as well, what are the current eligibility criteria for getting the vaccine at your pharmacy. Vaccine safety. So this website would give you more information about some of these side effects of the COVID-19 vaccine, and you can read more about it right here. Now I'm going to pass it on to Sanya.
Perfect, thanks Russell. So yeah, we learned a little bit about COVID vaccines as well as some reliable sources. So now we're going to transition a little bit into how we can work with our doctor during COVID-19. So as we are well aware now, given we're more than a year into the pandemic, the healthcare system has gone through a lot of changes in terms of how appointments are conducted and what that might look like for you as a patient or as a family member that is accompanying your loved one to an appointment. So a lot of them have transitioned, of course, from in-clinic to phone appointments, which has required the clinics to, rejig the way they work, as well as to have a lot of electronic systems set up. So if you are coming in for a in-person appointment, please make sure that you are well aware of sort of the restrictions and the safety standards that are outlined by the Government of Ontario through some of the sources that Russell outlined. So things like maintaining a safe distance and making sure you are fully masked, and of course, not coming in if you are not feeling well or have any COVID symptoms. And we'll go into a little bit more as to what our telephone appointments look like and how you can prepare best for those virtual visits. I also wanted to make a note here that we do have a YouTube video already made about how to prepare for virtual visits, so do check that out on the channel, and we'll go into that in a little bit on how you can do that. So right now, a lot of appointments at the clinic are being done virtually or by telephone. So essentially how the timeline works is that first our team will call you, in which case we will fill out your electronic chart. We'll ask you a couple of questions, just seeing how you've been doing in general. Usually that includes things like how your blood pressure is going, if you've been measuring it, what your current weight is, and also updating your medications list as well. After we've kind of gotten that information and sort of recent updates from you, there'll be a bit of a break in which we will be sort of updating that chart, conveying that to Dr. Curnew, and then he will be able to call you back after some time. Now, this might take a little bit of time in between, given that there's so many patients, and often the system is very different now because it's over phone. So we really encourage you during this waiting time to make the best use of it and check out some of our webinars and videos online to really get more educated about sort of different health topics. And that way you can kind of, if you have any questions from those videos, you can also bring them up when Dr. Curnew does give you that call. And of course, that last step is when Dr. Curnew calls you, in which case you can have a discussion with him about sort of the same updates. We'll review the information again, go over any testing results and blood work, and renew prescriptions and refills. So that's kind of the general timeline of how things are going with appointments. So again, we really want to encourage you in this era of virtual appointments to really take control of your own health. There's often, a lot of barriers to virtual visits, so it's really up to you to work together with Dr. Curnew and the rest of us volunteers here, so that we can achieve the best health possible for you. So what does that look like? That means knowing your pharmacy and your blood work lab, for example. So we usually like to update any information on our end in terms of who to send the prescription renewals to or the closest lab to you. So do make a note of sort of the address, the fax number, and let us know if any of that has changed so we can update it on our end for you. Another common one is to know your medications. When we do give you a call, it's very handy and helpful if you have a medications list with you, or if you have a, if you're by like your cabinet with all the medications in, and you can kind of list out the names, the doses, and how often you take them, so that we're able to kind of double check on our end and avoid any medication errors that we've talked about a lot in our previous videos as well. I'll jump over to the right side here. So blood pressure is a really big one. Of course, if you're doing a virtual appointment, it's really hard for us to manually physically check your blood pressure. So we really encourage everyone to get a blood pressure machine. It's a very good investment, and they can be found at a lot of local stores now around you in your neighborhood. And of course, measuring and tracking your blood pressure can prevent against heart disease and allow us to see what that trajectory looks like as the years go on. So it'd be really helpful if you have a machine handy, you're able to measure it when we give you a call, and we can note it down on our end and kind of simulate that as if you were here in person. Another thing similarly is having a weight scale. So again, these can be purchased nearby as well. Another risk factor for heart disease is being overweight. So really would like to track that trajectory, and it's good for you too to know how you're doing in terms of your weight goals, if you have any. And then exercise. So there's no perfect time to start getting healthy. I know there's been a lot of different restrictions with COVID in terms of gyms and rec centers, but really try to adapt and make the best of the situation. And small steps like going out for a walk or standing up instead of sitting for longer hours is really going to be key. And I just want to go back to this point here on the left-hand side is get educated. So that's kind of what I mentioned earlier about those little breaks in between the appointments. Do make sure that you're checking out a lot of the resources that we've made for you. We usually make them based on common topics or questions that you as patients bring into the clinic. So they're directed at you and made in collaboration with you sometimes too. So it's really great for you to get that extra knowledge in. So you might be wondering, well, how do I access these resources and these YouTube videos? And so we thought we might give you a bit of a refresher on where all these videos are. So a lot of them are hosted on our YouTube channel. So the best way to access them is to go online, either on your laptop, your phone, your iPad, or any other device, and go onto YouTube. So you can type in youtube.com. And usually at the top, there'll be a little search bar. And in the search bar, you can type in Greg Curnew, and then you'll see this lovely image of Dr. Curnew in this little bubble. And that is essentially the channel for Dr. Curnew. So if you click on that, you'll be able to see the homepage of the channel. And this is kind of what it looks like. There's different tabs at the top: home, videos, playlists, channels, etc. So you can kind of explore that. But what I wanted to highlight to you is the videos tab. So if you go into the videos tab, you'll be able to see our uploads from most recent to least recent. So here you can see some of the webinars that we have. So living with AFib, raising awareness about Crohn's disease. So we have webinars that happen every Friday nights, just like this one at 7 p.m. EST. And those are always recorded and posted on our YouTube channel. And then you'll also see some other videos we have. For example, here you can see 6 ways to improve your heart health. So these are smaller 5 to 7 minute videos that we release every Wednesday. So we've got kind of different options there in terms of the resources you want to access. You can also click the playlist tab, which actually categorizes a lot of these videos for you. So medication club, exercise club, using technology. So a lot of these are categorized if you are looking for something very specific you want to focus on. You're also able to search within the channel itself. So for example, if you are worried about your cholesterol levels and you want to learn a little bit more about that or about statin medication, you can search up cholesterol and all the relevant videos to that will pop up. Similar thing can be seen with hypertension. Again, we've got great resources to help you understand what high blood pressure means, how it relates to COVID-19, and other ways you can manage the risk factors for heart disease. And here's another example with diabetes as well. So lots of great resources for you. And if you ever have any questions on how to access those videos, please let us know. Either the tech team or Stuart or Dr. Curnew would all be really happy to help you out. And we know it's challenging at times, but we really want you to take advantage of these resources. So we'll move on now to talk a little bit about how to use Medio. So this is a platform that has been introduced a lot in healthcare systems to conduct virtual appointments. So while some of the appointments are over the phone, the clinic is trying to kind of expand the electronic systems it's able to use. And this might be something that you would be needing for your appointment as well. So I just wanted to walk through it a little bit in terms of what it might look like for you. So to use this, you would essentially go on to mediohealth.com, and there's a button on the right-hand corner called Login. So it'll ask you if you're a provider or a patient, and you can go ahead and click Patient Login for that. And then you'll get to a sign-in page. So in the sign-in page, you can enter in your email address and password. And if you don't have one already, you can actually create an account by clicking the sign up button at the bottom. And that'll just ask you for all your personal information, the email address you want to use, and then ask you to make a password for this platform. So when you're all logged in, this is kind of what your dashboard will look like. So I just want to go through some main sections of the dashboard here. So the part that's circled here in blue, that will show you your appointments for the day. So you can see here, for example, it says Dr. Sam Square, video appointment, and then it says office appointment as well. So that'll show you your appointments for the day. Underneath that, it's a section for your activity feed. So that's kind of your history of any previous interactions you've had on the platform. So any past appointments you had, any messages that you had, so just kind of tracking that history. On the right-hand side, where you see an image of someone masked, that's just an area that is more of a promotional section for Medio. They'll kind of give you updates or news that they think might be relevant for you. And underneath that, on the bottom right-hand side, you can see upcoming appointments. So that's also helpful for you to put into your calendar and see what's coming up next. And then if you go all the way to the left-hand side, you'll be able to see a panel. So you can see that it says dashboard, appointments, and inbox. So right now we're on the dashboard section, but if you go into the appointment section again, you'll be able to see sort of an overview of your appointments for the day. And then if you click your inbox, you'll be able to see any messages that you've been sending back and forth with Dr. Curnew. So for example, any attachments, any photos, any images, that's all tracked here. You can see here, for example, it says lab results, lab requisition. So that's a great way for you to access all that information there. Now, I wanted to go back to the dashboard to show you how you can actually join the appointment. So let's say you go into the today's appointment section. It should have a blue button there that says join my appointment. So you would simply click that button. And the first time you do it, Medio might ask you, for permission from your laptop to use your webcam and your microphone. So you might get a pop-up like this on the top left-hand corner. So just go ahead and click allow, and then it'll remember those preferences for next time. And before you join the call, you can also actually test out your webcam and your headphones or your speaker to make sure that your audio and video settings are working well. And if you have any trouble with those, you can also change sort of the device you're using, or you can make sure that your headset is working, for example, or contact the support page if you run into any serious issues in terms of connecting. So this is an example of a patient who's joined the call. Now, when you initially join and the doctor hasn't joined yet, this is kind of what the interface will look like. So you'll see yourself, your reflection, and then it'll say something like, your provider knows you're here and they'll join the session shortly. They might be finishing another appointment or just connecting in. So at this point, again, we ask that you wait patiently for Dr. Curnew to connect in. Again, really recommend that maybe in this time you go on to our YouTube channel, maybe search up some videos, write down any questions you might have for the appointment or any updates that you think are important to discuss in the appointment itself so that it can be as effective and as useful as possible for you. When the doctor does join, you'll be able to kind of see both faces here and interact that way. And in the event that you want to kind of use other features of the call, you can actually also send messages through the chat function, which is seen on the left-hand side here. This is super useful in the case that you want to send an image really quickly or an attachment really quickly, or let's say your audio isn't working and you'd rather just type it out. That's a great option there. And once your visit is complete, at the bottom of your video screen, you'll be able to see a panel with different options. And this icon here will allow you to end a call once that visit is complete. So that's kind of Medio altogether. Again, it's something that we're transitioning into. Again, there are challenges with kind of learning how to use all this technology. So if you have any questions or you're struggling to join the visits, please let us know and we'd be happy to kind of walk you through that slower or one-on-one as well. So we just wanted to end off here by talking a little bit about some important apps during COVID. With COVID, of course, with the digital era, we know that a lot of aspects of people's lives have changed, whether it comes to exercise or how we socialize, or even with all the information out there about vaccines and restrictions. So some of these apps are just going to help you manage some of those aspects a bit better. And we hope to kind of go into these even more in some of our future videos, but just kind of introduce them now so you can download them and take a look if you would like. So the first app that we have here is called Can Immunize. This is a digital immunization record for Canadians, and it's available both on Apple products as well as Android products as well. And the main focus of this app is to really help you track your proof of vaccinations, not just for COVID, but for a lot of other things as well. So you can use this for a variety of different things, and I've just listed some of them here. So you can use it to track your childhood, adult, and travel vaccinations for yourself and for your family members. You can receive reminders about upcoming vaccinations, again, not just for COVID, but for all the other routine immunizations that you might need to get done. You can also stay up to date with the vaccination schedule of your own Canadian province or territory. So when you join, it'll ask you your location and it'll be able to adapt its features for that location so that you're able to get the most up-to-date information in that sense. You're also able to create customized vaccination schedules for family members that are receiving sort of travel or other types of vaccinations. So it gives you a bit of flexibility there to kind of make your own schedule and put your own priorities in. You can also learn about outbreaks of vaccine preventable diseases and access information and resources about vaccination from trusted health resources. So again, going back to kind of what Russell was mentioning earlier on in our presentation about getting most up-to-date and reliable information, this is yet another way for you to make sure that the information you are getting is from a trusted source and something that you can rely on for further use. So these are just some screenshots of what the app itself might look like. So you can see here on the left-hand side, moving from left to right, it shows you sort of your records and the different names of all your family members. So this is something that you can use with your entire family. And you can see the list of the vaccination scheduled there. So for example, 2-month visit, 4-month visit for like an infant, for example, and then going into sort of the immunizations that your child might get during school. You can also add that in there. And then again, you can receive reminders for when it's time to vaccinate, which you can see here. And finally, if you are traveling, you are able to send these records electronically. It's connected actually to the Ontario health system and to public health. So no matter what region you live in, they're able to kind of access this app, and you can send it to your healthcare provider or also to any other authorities if it's needed for travel purposes. So that's Can Immunize. Again, really encourage you to check that out. It's a free app and available on most devices. And if you have any questions with that, we can also go through that a bit more as well. This is another app that Dr. Curnew wanted us to really highlight called Noom. So this is a fairly new app on weight loss. So I just wanted to go over some features of Noom. So again, with COVID, it's been harder and harder to kind of maybe have some of those in-person support groups that we used to with restrictions, and also just to exercise in general when it comes to, for example, gyms being closed or a lot of people isolating and being in quarantine. So apps like Noom are really, really great to help you kind of get back into the rhythm of things and be a bit more motivated to whatever your goals are. So Noom is actually able to provide you one-on-one coaching to help you achieve your personal health goals. So they give you a little 10-minute daily lessons that help you develop healthier habits. So you can insert sort of what your goal is, whether you want to lose X amount of weight in Y amount of time, and it'll be able to give you some tips and tricks on how you might be able to go about achieving that. It also actually has a food database, and a very diverse one, where you can track the food you're eating, and you can do that by scanning the barcode of the item or entering the food in, which I'll show you in just a second with the screenshot. It also has other health tracking tools like weight logging, water tracking, and step counting. So again, when it comes to health goals, it's very holistic. It doesn't just involve your weight. There's also, keeping yourself hydrated, keeping yourself moving. So kind of taking that holistic approach. And then finally, it gives you a lot of recipes that don't require you to restrict your diet, and a lot of flexibility for you if you want to kind of improve on that end as well. So we can see here some screenshots from Noom. So you can see, again, going from left to right, Noom's structured course helps you gradually master healthy habits. So you can see the different options that are presented in terms of logging your meals, logging your weight. If you are experiencing an anxiety with your goals, it will give you some tips and tricks on that, and also just how to change your plan if it's not working well for you. You can see that you're actually able to input your food itself. So here you see an example of someone trying to track their lunch. So for example, you can type in salad and it'll give you options. So did you have 2 cups? Did you have 1 serving? Did you have it with dressing? What were the ingredients? And this just lets you kind of keep better track of what you're eating and kind of what your calories intake is as well. There's also like I said, a personal coach feature. Now, some of these features might require in-app purchases, so just be aware of that. But you are able to get a trial for this if you find that you are struggling to keep in charge of your goals. There are individuals on the app that are able to help you virtually, and of course, you have us as a team to support you with that as well. And then finally, there's support groups for extra motivation. So again, it's been harder to connect with people in person. So you can lean on individuals who might be working towards similar goals as you, and be extra motivated, see what works for them, what you might be able to adapt, and share some of your own tips and stories as well. A lot of these goals can be hard to get to. It can be frustrating when you aren't seeing the progress that you want. So it's always great to kind of have that extra support and share some of your victories as well, and moments that you've been really proud of your progress. So that's kind of all we have for you today. Again, just a quick overview of the apps, the different updates with COVID. And again, we know that some of this technology can be hard to navigate, but we hope that both myself, Russell, and Jan Stewart have made it a little bit easier for you today, just to kind of give you some tips and tricks on how to do that. And again, I want to emphasize we are here to help you. We're very happy to chat with you one-on-one or in a team, to help you navigate through any challenges you might be having. So I'll pass it on to Stuart now for some final words.
Yeah, thank you so much, Sanya, Enya, and Russell, for putting together such a comprehensive webinar. I just really wanted to remind everyone who's joining us, so who will spend some time to listen to our videos, that your healthcare provider may use many different ways of trying to connect with you throughout the pandemic. Today we presented one service called Medio, which is quite popular amongst doctors in Canada, as a way to sort of lead video and audio interactions with you. But doctors may use them for different purposes. For example, in Dr. Curnew's clinic, he's primarily focused on using it for sending over blood requisition forms for you. So if you need a requisition for a future appointment, Dr. Curnew would simply require an email address. That way he can send you it through Medio, and you can print it out and use it the next time you go to Life Labs or Dynacare to get your blood work completed. So for that reason, we just encourage you for future appointments just to let one of the individuals who give you a call know what the email is that you most use frequently, and that way we can get you a blood requisition form. And as well, I just do encourage everyone to also know that if you ever have any questions about how to navigate YouTube, how to download apps, or how to find Medio online, for example, many of the student volunteers are quite proficient with the use of technology, so we're all quite comfortable spending some extra time with you answering any questions you have. So if you'd like to send us an email, you're more than welcome to use the email you see on the screen. But if you'd also just like to wait for your next appointment and ask some questions over the phone with one of our students, you're also more than welcome to do that. Really, whatever your preference is. We just wanted to make it as easy and as accessible for you as possible. So with that, I'd just like to thank Sanya, Enya, and Russell for putting together a great webinar. And I just wanted to thank everyone for joining us tonight. With that said, we'll end tonight's webinar, and we look forward to connecting with you next week when we're going to be talking about congestive heart failure. With that, we'll say goodnight, and we look forward to seeing you soon. Take care, everyone. Bye-bye.